Adolescent sharing is a social issue that affects more than only the pregnant female. According to the U.S. Department of Health and Human Services, there were 61.8 births per every 1,000 female, ages 15 to 19 years old. In recent years, teen pregnancies have declined. There were approximately 26.6 births per 1,000 female adolescent in 2013. Although birth rates among adolescents have dropped within the last 20 years, the problem is still an everlasting phenomenon. The adolescent birth rate in the United States is still on the high end of the spectrum compared to other developing countries. Having a child before 19 years of age often makes education, work experience, financial stability more difficult to obtain. Not only is the parent at risk, but the children of adolescent parents are more likely to face challenges as well. In 2012, the economic cost of teen pregnancy and childbirth accounted for at least $1.4 billion to the U.S. dollar taxpayers. The psychosocial complication of adolescent pregnancy is significant and of the national concern because of the resulting societal, economic, educational disadvantages these teen mothers and their babies face. There are two types of pregnancy prevention programs utilized in school settings. Those include abstinence-only and comprehensive. Hispanic and African American adolescents aged 15-19 years old are a priority population in need of greater public health effort to improve life opportunities due to their high pregnancy rates.
Teenage pregnancy occurs for a variety of reasons. The top 3 reasons include not using contraception properly, not using any methods of contraception, or planning on getting pregnant on purpose. Cultural competence in research is extremely important. We found that especially at-risk group are Native Americans because they are more likely to be engaged in sexual intercourse and have lower contraceptive use than other youth groups. A challenge in dealing with this population is that there is little known about the cultural perspective on childbearing. In fact, we could only find 2 published articles specific to Native American populations. Many of these communities reported several barriers to prevention services, such as hesitance to seek medical help due to perceived negative attitudes. Studies have found that contraceptive use among sexually active adolescents is inconsistent, and many don't know what options, if any, are available. The overall lack of education on the subject reflects this inconsistency. Many studies have found that there are multiple barriers to consider when reviewing or implementing pregnancy prevention programs. Some reported lack of transportation, stress, missing school, family problems, including the fear of telling their families about the pregnancy, and even confusion about what services were available. Unintended pregnancies may result in many struggles or adversities for the individual compared to planned pregnancies. One example demonstrates that during an unintended pregnancy, the majority of individuals struggle with financial issues and other maternal stressors. Later in life, teen parents could also face other health and behavioral issues, including drug use, neglect, and later teen pregnancy. While many teens find it difficult to find support, there are some supportive services out there. One such program, the Mother Mount Sinai, assisted adolescent females in going to school and holding support groups for them once a week. Data indicated years that the group was held, 8% of participants graduated from high school and 90% believed they were on a successful track. An approximate 25% of teen moms have a second child by the age of 20. Students in other studies report the need to develop their problem-solving skills and opportunity to discuss goals or plans for the future as part of the pregnancy prevention program. Teens stated that seeing the struggles they were having in relation to going to school, family obligations, and parenting stressed the importance of using condoms or delaying sexual practices. Studies show that comprehensive programs take an approach that aim to improve both the short and long-term well-being of parenting adolescents. One such program was the Early Childhood Center Children of Teen Parents program. Their goals include providing health services for adolescents enrolled in the program, ensuring that adolescents received appropriate child care, and ensuring that adolescents were academically and emotionally ready to enter school. The program was successful in keeping mothers in school through graduation and attributed much of its success to the accessibility of the child care services offered, coordination provided, and the informal case management system. Another example of a comprehensive program is that, in addition to educational classes, the Lawrence Paquin School program provided employment counseling services, parent education, transportation assistance, child care services, in-school health clinic services, planning, information and services, health education, breastfeeding counseling, and social service. Paquin School showed higher educational aspirations and attainment, better infant outcomes, and better family planning practices.
As we stated, there are two main types of pregnancy prevention programs used in schools: abstinence only, which focus on refusal skills and the consequences of premarital sex, and comprehensive sex education, which teaches about abstinence, contraception, sexually transmitted infections, abortion, and HIV. Studies have found that comprehensive sex education programs have helped increase use of contraception, reduce the risk of STIs, as well as delay the initiation of sex in adolescence, particularly among African American and female students. Other studies focusing on abstinence-only sex education have found that these programs did not significantly impact the rates of sexual abstinence, number of sex partners, pregnancy, or contraception use. However, in a particular study, students in abstinence programs had a greater involvement in problem behaviors. Some programs included parental participation, and all the results of these studies are not known. The initiative is promising. Educating adults and parents about the effectiveness of sex education has been found to be needed, especially for minorities, males, and lower-income individuals who ironically are more susceptible, yet believe more in abstinence-only programs. Studies analyzing the long-term effects of sex education found that students who participated in comprehensive sex education were more knowledgeable about HIV and had more positive behaviors towards safer sex behaviors. While the results of many studies promise, there are limitations. Sometimes it is unclear in regards to how these results were achieved. Another limitation of these various studies includes that few follow the intervention group past a few years. Although most programs with a comprehensive model seem to have succeeded in improving outcomes for teenage mothers, most of the studies were limited because of lack of randomization and potential for bias in their sample.
Research design for this project, we are using the Personal Responsibility Education Program, or PREP, the Safer Choices curriculum as the intervention. Safer Choices is a 2-year school-based program. The program is a prevention program designed to address HIV, sexually transmitted infections, and pregnancy. The program includes Health Protection Council, the Safer Choices curriculum, to sponsor school-wide events and activities, parenting education, connection to community-based services. Occasionally, there'll be an HIV-positive speaker. The program is delivered in 20 sequential sessions divided evenly between 9th and 10th grades. Parents receive a newsletter, participate in some student-parent homework, and a connection to community-based services allows for multiple activities to increase students' knowledge of and access to support services. Using post-test surveys, we will be able to see changes in adolescents' behavior before and after the intervention. Specifically, increased use of contraceptives, delayed onset of sexual activity, and delayed onset to age of first-time pregnancy. The following operational definitions were used. Use of contraceptives will be measured by the consistency at which participants utilize the contraceptive method, a condom, pill, patch, ring, IUD, or injection, when engaging in sexual intercourse during the last 6 months. The percent of sexual activity will be the age at which participants have their first sexual encounter, and pregnancy rate will be measured in the number of pregnancies girls 18 and younger have experienced. Participants will be randomly recruited from 50 Denver public high schools in order to have an accurate representation of the Denver metropolitan adolescent population. All high school students will participate in the survey, however, not all students will participate in Safer Choices program. The goal will be to obtain 25% of the program participants to be a part of a quantitative study. Their characteristics will socioeconomic minority groups. In order to make the findings more generalized, the goal is to recruit about 500 high school students ages 14 to 18, representing American Indian, Alaska Native, Asian, Black or African American, Hispanic, Native Hawaiian, and white ethnicities. Multivariate statistics will be utilized in investigation due to the large population size. This method was chosen because it takes multiple factors and relationships among. To explain, the survey addresses several dynamics in sexual orientation, number of partners, use of contraception, past and present sexual activity, and pregnancies. Through multivariate analysis, we can identify dominant patterns and relationship between variables in our data. This allows us to hypothesize that the success of our intervention is influenced by the variables listed.
Overall, there's a gap in service available that would encompass all racial, ethnic, and ethnic experiences. Research indicates that comprehensive sexual education provided in a school setting decreases onset of sexual activity as well as increases contraception use. The Safer Choices program will implement services for adolescents to acquire education, skills, and methods utilized for adolescents at risk of teenage pregnancy. These skills are universal to adolescents and are one piece of an educational puzzle that helps students toward becoming successful adults. Through continuous studies and investigation, researchers will be able to identify what programs thrive and are beneficial to assist and decrease adolescent pregnancy.